Sarah had always dreamed of passing the Nclex on her first try, but when she first opened the practice questions, she felt overwhelmed. The words reduction of risk, potential, sounded like a maze she couldn't navigate. She remembered her first semester memorizing labs and procedures without really understanding why they mattered, only to find herself confused in clinical simulations. Back then, interpreting an ABG, checking electrolytes, or understanding coagulation labs seemed impossible, and she often questioned whether she was cut out for nursing. Then came her transformation. Sarah realized that Nclex isn't about memorization. It's about anticipating what could go wrong and knowing how to prevent harm before it happens. She learned that understanding labs like sodium, potassium, calcium, and magnesium could mean the difference between early intervention and a life-threatening event. She could now recognize respiratory acidosis or alkalosis, metabolic acidosis or alkalosis, and immediately correlate them with a patient's condition. CBCs weren't just numbers anymore. She could detect anemia, infection, or thrombocytopenia risks at a glance. Cardiac enzymes like troponin and CKMB told her if the heart was under threat, and she could prioritize patients at risk for shock or myocardial infarction. She understood PT/INR and APTT not as abstract values, but as life-saving tools to anticipate bleeding or clotting complications. She could calculate therapeutic drug levels and detect early toxicity, whether it was digoxin, lithium, phenytoin, or vancomycin. Her first encounters with diagnostic procedures had been frightening. Endoscopies, lumbar punctures, biopsies, or thoracentesis all seemed risky. But now Sarah could anticipate complications. She knew that a patient post-lumbar puncture might develop a spinal headache, that a thoracentesis could cause pneumothorax, or that contrast dye might induce acute kidney injury. She could plan, monitor, and respond proactively, reducing the risk of patient deterioration. She had learned to connect the dots, how pre-op assessments, post-op care, early ambulation, incentive spirometer use, and careful wound monitoring could prevent pneumonia, DVT, dehiscence, or infection. Fluid and electrolyte imbalances were no longer abstract concepts. Sarah could spot hypernatremia, hypokalemia, hypercalcemia, fluid overload, dehydration, third spacing, and know immediately which interventions to prioritize. She recognized early signs: confusion signaling hyponatremia, weakness hinting at hypokalemia, or shortness of breath from fluid overload. She learned that early recognition could prevent progression to shock, cardiac arrest, or multi-organ failure. In her clinical rotations, Sarah saw patients with neurological, respiratory, cardiac, renal, endocrine, and GI complications. She learned to anticipate increased ICP, seizures, stroke, respiratory failure, ARDS, pulmonary embolism, myocardial infarction, peritonitis, bowel perforation, acute kidney injury, DKA, and hyperosmolar hyperglycemic state. She knew that recognizing subtle early signs, like slight confusion, restlessness, tachypnea, or hypotension, could mean the difference between rapid recovery and life-threatening deterioration. Medications and therapies posed hidden risks. Sarah mastered monitoring for oxygen toxicity, TPN complications, central line infections, CLABSI, CAUTI, VAP, dialysis hypotension for infiltration, epidural hypotension, suctioning hypoxia, and blood transfusion reactions. She understood that being proactive, not reactive, was the essence of reduction of risk potential. Even special populations became predictable. Sarah now anticipated maternal complications like preeclampsia, eclampsia, HELLP syndrome, placenta previa, placental abruption, uterine rupture, and postpartum hemorrhage. Pediatric risks like dehydration, respiratory distress, hypoglycemia, RSV, intussusception, and epiglottitis no longer made her anxious. She knew the red flags. She understood geriatric risks, delirium, falls, polypharmacy interactions, pressure injuries, and aspiration. She could spot early warning signs in ENT, eye, and allergic emergencies, from acute glaucoma to retinal detachment to anaphylaxis, oncology emergencies like tumor lysis syndrome, spinal cord compression, superior vena cava syndrome, hypercalcemia, neutropenic fever, and septic shock were no longer intimidating. She knew how to prioritize and intervene. Environmental and trauma emergencies, poisoning, burns, frostbite, heat stroke, hypothermia, electrical injuries, snake and insect bites, and drowning were all scenarios she could manage systematically. Sarah's. Then self would have panicked at the thought of reading an Nclex question and deciding which patient to attend first. Her now self could scan a scenario, identify early warning signs, anticipate potential complications, and apply interventions without hesitation. She realized that Nclex tests judgment and foresight more than memorization. It rewards nurses who can predict risk and prevent harm. By the end of her preparation, Sarah understood the true meaning of reduction of risk potential. It wasn't just a category, it was a mindset. She had transformed from a student overwhelmed by numbers, labs, and procedures into a confident nurse capable of identifying subtle dangers, anticipating complications, and taking decisive action. She could now see the cascade before it began, what could go wrong, how to prevent it, and when to escalate care. When she received her Nclex results, it wasn't just a number, it was confirmation that she had mastered risk reduction. She smiled, knowing she had internalized every scenario, complication, and preventive measure. The journey wasn't easy, but she had achieved what many feared, passing with a level of understanding that went beyond mere passing standards. If you are a first-time Nclex candidate watching this, remember, understanding each category deeply is the key. Do not aim for just passing, aim for mastery. Anticipate, predict, and prevent. Your ability to reduce risk can save lives and make you an exceptional nurse. Keep studying, practice with real scenarios, and watch the signs before they become emergencies. Mastery is possible, and your success story can be the next.